Hi, I am Dr. Agar and I will tell about very important topic, infertility. So why it's very important? Because nowadays infertility is very common in working women like IT field, late marriage and a late decision, and because of some issue this infertility rate is increasing. So what is the meaning of infertility? So first is definition, second is cause, third is which test is required, and fourth is treatment. So I will tell one by one. Infertility, when a couple when a couple for 1 year continuously, for 1 year they will make a relations or they will do intercourse without protections, and there is a failure of pregnancy, that is called infertility. So when a couple they are living together, they are performing, and they are unable to achieve pregnancy, that is called infertility. And infertility in both either male and female, but male is less and female is more. So this is the definitions, and this infertility is increasing day by day, and the actual, when the girls marries in time and they decide early their family, so they are getting good result. But late marriage and these issues and this infertility gives a lot of problem to a woman, like a physical, mental, social, and family issue. They are getting lot of issue, they are getting lot of problems, or they are facing lot of issue because of infertility. So what is the cause here? So cause I will tell in broad, you can see here. One is ovulatory disorder. Second is endometriosis. Third is pelvic adhesion. Fourth is tubal block. Fifth is other issue. So here you need to understand why this infertility is increasing and why this issue. So first is ovulatory disorder. There is a ovulations which is causing pregnancy. So in this ovulatory disorder, ovulation will be less, like ovulation will be less, or there is no ovulations. So if there is no ovulations or ovulation is very less, so there is a no chance of pregnancy. So ovulations occurs at the age of ovulation occur on 14th to 16th day of menses. So the ovum size should be 18 or 20. So sometimes because of this issue, ovulation will not occur or occur in less. Because of PCOD, because of PCOS, because of some hormonal imbalance. So there is a sex hormone which is present in women. So like luteinizing hormone, estradiol hormones, and progesterone hormones, and anti-mullerian hormones, which is causing this issue. And second is endometriosis. So you can see here, this is this is uterus, and this is ovary, and this one is fallopian tube. This one is, so sometimes this outer layer of uterus is called endometriosis. So sometimes there is a fibroid in this area, or uterus get enlarged, or sometimes other issue like less space because of swelling, or sometimes double uterus which is causing abortions. So abortions in 1 month, 2 month, or 3 month causing this issue. So they are not able to hold the baby. So this is endometriosis. And third is pelvic adhesions. So there is an infection in pelvic area called pelvic inflammatory disease. So in that situations, most of the times this, because of infections and because of this pelvic inflammatory disease, so there is a problems, and this is failure of pregnancy. Fourth is tube block. So tube block, this is, as you know, this is tube, so sometimes there is a blockage either one side or both side. So this is tube block, and as you know, this ovum released from ovary and come to here, and the sperm comes from here, it get fertilized here. So because of blockage, the ovum is not coming here, so there is a failure of pregnancy. So either one side or both side is blockage, that is called tubal blockage. Other issue, as you know, there is some BP like blood pressure, hypertension, or sugar, or hypothyroidism or hyperthyroidism, and some other issue like a late marriage. So nowadays, if girls is getting educations, so as you know, there is a, if they will do UG undergraduate, so the age is around 23, 24. They are doing some PhDs, so that is around 25, 26. But because of late decision, like no, I will do job, and then I will get married, so the age is going to be crossed more than like a 28, 30. So there is less chance of pregnancy. Second, if they are getting married, so they want to enjoy, so late decision, so 2, 3 years or 4 years they will delay, so there is less chance of pregnancy. And some other like financial issue, some other issue that is causing this infertility. And test is very important here. Test is for both male and female. So for male test, like RBS and HbA1c, and semen analysis, and testosterone, sex hormones, this is male test is required. On for female, they required lot of test. So some basic blood test like RBS, HbA1c, urine routine, and hemoglobin. So these are some other hormone tests like LH, AMH, estradiol, progesterone, thyroid. So these are the hormonal tests. And then they required ultrasonography or other hysteroscopy, which is very ideal test to see the uterus. That is called hysteroscopy. It is very useful. And laparoscopic. So if there is some PCOD or cyst, or there is tubal block, so they will do the laparoscopic to find out any issue in the female reproductive system. So they will see. And here they are coming to treatment issue base. So this treatment, as I told you, so there is a few important things which women want to know. So the childbearing age or best age for conceiving baby is 16 to 34 as a research. So but as the Indian constitutions, as you know, the marriage is above 18, so we can consider 18 to the 34, because in this age the girls is getting pregnancy very easily, and within like if they married as they of 22 or 24 or 25, so below the age of 25, there is chance of lot of chance of pregnancy. And second things, delay. So because of delay decision, because of delay marriage, this is the main issue. So I will tell in treatment and precaution is the main important. First is a timely marriage. So if girl is educated and or getting education or pursuing educations, so if they will complete the education, they should marry. Second things, in the early, if they get marriage and in the first year of the marriage, it is more chances for getting pregnancy. But because of uh, some issue like financial or some enjoyment, what the reason they gives, so they will not accept the baby at the first year. But there is a lot of chance, more than 37% chance of getting pregnancy in first year. So that is a big mistake. So you should accept the first pregnancy, because you don't know the God will give next or not, we are not sure. So second and third is uh, like using of contraceptive or pills before marriage or after marriage to avoid pregnancy. This is the another big issue, so don't do such things. And fourth, any issue like you are obese or you having thyroid, you having sugar or you having any other issue, so control it and reduce your weight. And fourth, if you having any PCOD or PCOS or any hormonal disorder or any period issue, you should correct it with your gynecologist opinion. And now I'm coming for treatment. So treatment will be two bases. One is medicines and second is IUI and IVF. So medicine basis, there is a hormonal treatment like controlled hyper secretions. So there is a clomiphene citrate which gives in starting stage first line treatment. So if this is failed, then letrozole to be continue more than 3 to 6 months. If this is also failed, then other treatment, like if there is some issue with the ovum or ovulations, like a size is less than 15-14, so there is a human gonadotrophin hormones which is giving, which increase the size of ovum and help in ovulations and increase the size, which is helping to conceive. And now I am coming IVF, IVI and IVF. So this is decided by your gynecologist. IUI, intrauterine inseminations, where the semen is inserted to your uterus. But this is I will not tell that best practice is not good, because a lot of failure is here. But IVF is very good when you are tired with all the treatment. And the last options, when you are performing, you are with your husband, you are with your couples, you are with everything, like you are healthy, you are planning, you are taking treatment, you are everything you are doing, but you are not getting result for 2 to 3 years or 4 years, you are tired with that. So what the last hope is IVF, in vitro fertilization, in other words called test tube baby. So that is your IVF specialist gynecologist, let's give you best result and best options and explanation about that, because there is a lot of process which they need to prepare before the IVF. So that is done by your IVF gynecologist expert. And I hope this video is very useful. And I will tell you, to educated women, please don't take me wrong, but this is the fact. Don't waste your time because of money, because of good choice and your late marriage. Best do marriage at the good time and plan for a baby, so you are not going to suffer this infertility issue, and you can avoid this. And I request you, please share this video, so it is very helpful. People can watch and people can follow a few tips. And thank you for watching.